A tale of two health systems. How do you get your records from one to the other? Both use Epic. Both are pretty close to each other. Should be easy, right? So I've been working in health tech for almost a decade at this point. I currently work at a company called HTD Health, where I advise health systems, health technologies, third-party applications on how to best integrate and interoperate with each other, from these nationwide organizations that cover a lot of patient lives to really small digital health startups that are looking to do something cool with an app. Last week, CMS and the White House came out with a huge announcement all about health tech and this ecosystem that they're trying to build. 60 plus gigantic companies, including health tech companies, electronic health records, payers, big tech companies like Microsoft and Google, and also some AI companies have pledged to uphold some of these guidelines. They're in a healthy competition between each other to see who can get there first and become CMS aligned. And we'll see if that's enough incentive to actually drive this forward. Many of us in the industry have already taken to LinkedIn and shared our either hopeful and excited or jaded or a little bit of both opinions, including myself. But I think everybody should care about this announcement, especially since it's focused on a patient-centric ecosystem. So what does patient-centric even mean? Today, when you go into a coffee shop, you might be very used to them asking for your name for your order so that they can yell it out at the end to give you your coffee. But what if instead of just your name, they asked for your name, your date of birth, your social security number, your address? Once they ask you all that information, they decide they need to call up the last coffee shop that you went to so that they can figure out how many shots of espresso you usually like, how many pumps of vanilla, caramel, hazelnut, whatever the heck your order is. And they also need to ask, how did this person pay for it? Was it Visa, MasterCard, Amex? Did they give you cash? All these different questions that they'd asked the previous coffee shop instead of just going directly to you. But that's not what happens. You just give them your name, you tell them your order that you want that day, and then you pay. You use your phone, you use a credit card, or some people might still use cash. Now think of your last doctor's appointment. If you have a fairly modern office, they might have a tablet that you can sign into, but a lot of places will still hand you a clipboard. And they'll ask the same 10 to 15 questions that you've filled out the past 100 times you've been there. And if you've been anywhere else besides that office since your last visit, you can't be very confident that they will have the most updated care information for you. Shouldn't we be able to pull out our phone like we did at the coffee shop, or when you're getting onto a flight, or checking into the gym? Or for some of the older folks, couldn't we carry a card like our credit card? I think we already do that when we get care, our insurance card, something like that to check in, where it will carry the latest information that we have and be available for those doctors so that you don't have to do anything else besides just wait to be seen. I've worked in the interoperability industry for years, and we like to think that we have these simple scenarios figured out. We flaunt that billions of records are exchanged yearly, that information really does flow for patients. But I think a lot of people have either very personal experiences or know of others where the system still does not work as it's intended. Just the other day, I got a text from my mom as I was actually thinking about all this. A very close family friend, somebody that I've personally known for many years, is unfortunately experiencing quite a few neurological issues. It's pretty scary for her. Now, unfortunately, her symptoms have persisted and she wants to go see a specialist. And she's had a hell of a time getting her medical information transferred from the system she's currently been seen at to the other. And instead of being able to just focus on getting better, this has been a big pain in her butt and something that should be easy. These health systems are close together geographically, and they both use the same electronic medical system, Epic. And no, I'm not talking about the one that makes Fortnite. For those of us in the industry, we know this should be the most simple possible scenario. We know there's a bunch of technical hurdles that could actually stop this from happening, but honestly, I don't think that's the problem at all. Instead, I think this particular provider's office either needs to be trained initially on how to do this through Care Everywhere, if we want to get specific. They either need a refresher on that training, or the most likely scenario is they just don't have the time to focus with each and every one of their patients for how to get through all of this. So instead of the system working as it should, instead of it all going according to plan, everything gets put onto the patient. And that could be fine if we did truly have a patient-centric ecosystem right now. So what does this actually look like for the patient? We have the top EHR that's in the country. We have probably the best patient portal offering that there is out there, or at least the most widely used. What does this actually tactically look like for a patient to be able to share their medical records today? Well, you got a few options. You can call your health system up, talk to Health Identity Management, and request your records. That'll take a few days, weeks, etc. I think they'll either fax that right to your provider, they'll email it potentially, probably not, or you can go in, pick up your paper record, and hope that you have enough trunk space to fit it if you're a complex patient. So not the most convenient option in the world. Or modern technology, you can pull out your smartphone, go to the MyChart app, and then you've got a few potential options there. Within MyChart, there's a thing called Share Everywhere. What that does is it generates a code that you can give to the clinician you're seeing at the time of care. They can go to shareeverywhere.epic.com and they can put in that code to then pull what we call your patient level information. So that's stuff like your active medications, your allergy, immunizations that you've had, and any current health issues. That's decent for some use cases, though my family friend that we talked about, who's a little bit more complex, I don't think that's going to get everything that they're wanting to look at that specialist. That's also generally used for folks who may not have access to an EHR, so certain really specific specialties that haven't ported over to an electronic side yet, or even somewhere like a nursing home that may have a computer and a browser, hopefully, but no actual EHR that they document on. There's also the MyChart Sharing Hub, which you need to scroll down in your MyChart menu for. And there you have a few different options. You can download things to your own device, which can be a little tricky for less technical savvy folks. They might not be used to dealing with file management on their own. And it's also a question of, do I want my most recent visit? Do I want a period of time, or do I want everything? And if it's everything, nobody's going to be able to just look at that the moment you come into the office and see what they need to do for you. The other option is right from there, you can try to send it to a provider. You can look them up by their credentials and send it directly into their EHR. But I would imagine that that flow would be just as difficult for an office to handle as if they were using Care Everywhere. So I don't think it would work in this case for our family friend. You can also send it to what's called a direct address, which for the purposes of this conversation is basically a secure email that many times can be accessed within the provider's EHR. And then you can also straight up email it to them. Not great for personal health information. And also a lot of times providers will not be logged into their own email client at a computer where they have Epic pulled up. The other options you have within this sharing hub is to request a formal copy. That's what we talked about with the Health Identity Management Department, except you're requesting it electronically instead of calling them up. A little bit more convenient on the get-go there, but it's still ultimately the same problem with how that's delivered to you on the back end. Do you really want all these papers with your whole history? One thing that might happen is they might be able to give you a USB drive that you can take with you, but again, that will get out of date as soon as you go to your next visit. There's also an option here for third-party app access. This one's a little bit more modern and interesting. It's basically single sign-on or SSO for the more tech-savvy people. This is where you might log into any kind of service using your Google or Facebook or Twitter credentials. But in this case, you're using your MyChart account to sign in. And what's nice is you do get some levers in terms of the access you give that third party using this method. That's actually kind of cool and hopefully something that we see a lot more of in the future. You can also extend my chart to other people in your family from the sharing hub, but that's not the scenario we're talking about here when you want to go see a provider and get your med records from the last place. I'm sure there's a bunch of other features, but for the purposes of today, that's our basic scenario that we have for our family friend. And you can see not great options and still a lot of work on the patient side. Ultimately, I don't see many folks doing this. I myself wanted to send some screenshots to our friend. It was a little confusing to get there, and I'm somebody who spends all my time doing things like this. And I can see people just really stopping and saying, forget it, and then not ending up with the medical information they need at that visit that they're going to. So, summing this all up, we're not at a great place right now. I think there's a long way to go before we get to perfect. But I am excited about this future where we put more power into the patient's hands. Let's see what this looks like in a few years.
Hey, what can I get you?
Yeah, I got a few issues. I think I'll take an x-ray for my foot. Also, haven't been getting upstairs very easily lately, so might as well throw in an EKG.
Do you want any shots with that?
I guess I'll just do one shot. Maybe the flu?
That'll be $45,352. How would you like to pay for that?
Yikes. While you're at it, can I just sell you my kidney?